One of the challenging cases that I've taken care of here at Hasbro Children's Hospital is a baby who I first met when she was 6 months old, and I was a subspecialty fellow training here in pediatric hematology oncology. This patient came into our emergency department with a large mass on her thigh at the site of her recent immunizations. She had a young first-time mother who noticed this area and was very concerned about it. This is a common concern that we see in pediatrics, and most of the time, these swellings at the site of immunizations are not anything to be concerned about, and they resolve with time. However, in this case, this mother knew that something more serious was wrong with her child. When we evaluated her in the emergency department, we also knew right away that something more serious was going on. She had a large swelling over her entire thigh, and she was also pale with small bruises and had an enlarged liver and spleen. We sent her blood to the laboratory to be evaluated, and were called almost immediately that the white blood cell count was so high that it was blocking the machine and unable to be resulted. We eventually determined that her white blood cell count was more than 800,000, with a normal white blood cell count for a baby her age being around 10,000, so significantly different than normal. She also had a critically low number of platelet cells in her blood and red blood cells in her blood. We admitted this child to the pediatric intensive care unit and were able to rapidly start filtering her blood to remove her abnormal white blood cells, all while we were working on obtaining the appropriate diagnosis. She had a diagnosis of B-cell acute lymphoblastic leukemia. When this disease occurs in very young children who are less than 1 year old, it can be very difficult to treat with concerns for both recurrent disease and serious side effects of therapy. She did well with her initial chemotherapy and was able to continue therapy as an outpatient, coming to see us weekly for her maintenance chemotherapy. She was growing and thriving. It was a pleasure to take care of her and her family during this time. But unfortunately, about 2 years from her original diagnosis, she came in again with signs of her leukemia. She had leukemia growing in both her bone marrow and in the fluid around her brain and spine. She received additional chemotherapy at this time, and luckily she had a younger brother who had been born since she was diagnosed with leukemia, who was a perfect match for her to receive a bone marrow transplant. She received high doses of chemotherapy, radiation therapy, and then received stem cells from her brother. And following this, she underwent a long period of recovery from all of these treatments and from how the transplant allows the new immune system to grow into place. We now continue to follow this patient 16 years after her transplant, successfully treated and cured for her leukemia in our survivorship group, where we have a multidisciplinary team from pediatrics, pediatric hematology oncology, adult medicine, pediatric endocrinology, social work, neuropsychology, all these areas contributing to watching for long-term effects of chemotherapy and radiation therapy. So it has been absolutely my pleasure to care for her for now almost 18 years from her diagnosis of leukemia.